Okay, welcome everybody to this is our first event in our NALHE Central Texas Health Bite series. That is a lunchtime series where we're going to have shorter sessions, less than an hour, and give people time to ask a few questions, eat lunch, and be done during their lunch hour. Hopefully learn something useful, which I'm sure today will be. We're going to have Amanda Brummett today. She's going to present her talk called Elevate Experience, Expand Reach, Drive Referrals to help mainly medical practices. And I think she's going to talk around 20 minutes, and then we'll have time for questions after. So it'll last around 30 minutes, but we can always stay on a little bit longer if you have questions up until probably around 1. So be thinking of your questions. Okay, I'll introduce Amanda real quick. She's on the NALHE board and she has 24 years of healthcare leadership experience. She specializes in growing and optimizing physician practices, ambulatory surgery centers, infusion centers, and hospitals. And her expertise spans physician practice management, recruitment, operations, patient experience, and strategic growth. She's held executive roles with HCA Inc. and Metro Anesthesia, which is Texas' largest private practice anesthesia practice, giving her a unique insight into both provider and administrator perspectives. And as a founder of the Brummett Group, she partners with clients to drive development, marketing, and operational excellence. She has a Bachelor of Business Administration, a Master of Health Administration, and is a fellow of the American College of Healthcare Executives. So today she'll talk about enhancing patient experience, expanding direct-to-consumer marketing strategies, and driving more referrals from other providers. So thank you and welcome, Amanda.
Yeah, thank you, Lauren. Glad to be here. So this is going to be very rapid fire. I know we've got somebody from the hospital side, so thank you for being here, and somebody from pediatric, OT, PT, and speech. If the rest of you don't mind, if you'll drop in the chat where you're from, then that will help me on the fly kind of tailor it to you. A lot of these strategies are pretty broad, and especially for like a hospital, definitely all of the strategies work. But if you're a pediatric transplant surgeon, we may want to specify and hone in a little bit more in different areas. So if you feel comfortable dropping that in the chat, I'll customize to you. And if not, that works too. So we'll go rapid fire, and then in the last 10 minutes, if you've got time, absolutely ask questions. And then if there's anything that you want, we can get into more depth on it. So with that, let's dive in. So first, and don't hate me for saying this, but it's easier to keep your existing patients happy than it is to get new patients. And what I have found after years and years of doing this and spending people's time and spending people's money is that we all get excited and we all want to start with marketing, and we want to get out there and meet consumers, and we want to get out there and meet other providers and get referrals in. And I'm all for both of those strategies. But first, we have to look what's going on internally and make sure we're in a good spot to market. Otherwise, we can waste a lot of money, and we can actually potentially even harm the practice through almost negative marketing, which I'll walk you through the presentation today. So with that, let's start with what is going on right now in your practice and your existing patient experience. So first and foremost, think about that most of the time people for, especially let's say we've got some pediatric therapy practices on here. None of us are excited when our kids get a diagnosis. We're terrified. We're scared. We're worried about our kids' health. We're worried about how much money it's going to cost. With the hospital, unless you're having a baby or some kind of fun plastic surgery, you also probably don't want to be there. Nobody wants appendicitis. Nobody wants a knee replacement. So just kind of at the very beginning, taking a step back and thinking about when people hit our doors, they're already not having the best day of their life and maybe having a pretty rough day. So what can we do to make that patient experience as frictionless as possible? And it starts before we even get to the hospital, to the practice. And so I highly encourage you guys as leaders of your practices to start by secret shopping your own entity. Start on the phone, call. What's it like? A little bit harder on the hospital side, but do it. See what happens. On the outpatient practice side, call not from your number because they know your number, but call to schedule an appointment. See what it takes. How many hoops do you have to jump through? Is the staff friendly? Are they kind? Are they empathetic? Are they warm? Do they make it easy? And go ahead and be that difficult patient. Ask some hard questions. Throw out an obscure insurance plan and see if they come back with, let me check into that for you, or if they just say no. See how that goes. Make sure that's positive, because I am telling you, if that first human that they interact with on the phone, again, unless you're a pediatric transplant surgeon or some highly specialized specialty, if that first person isn't nice, they might just move on. So phone secret shopping, super easy. You can do it yourself. Ask your friends, ask your family, and just get tangible feedback, and then retrain and re-educate on that as needed. Then second, I want you to physically visit your practice. Don't go in through the door where you normally go in. Pull into the parking lot. Especially true for the hospital. What does the wayfinding look like? When you pull in, if you know nothing, can you figure out where you need to go? We probably can't fix parking, but we can totally fix signage and making that really easy. And if it is confusing to figure out where to go, then maybe that's something we share with patients on the front end, that, when you're coming in for XYZ on the morning of your procedure or on the day of your therapy, here's where you're going to park. Here's where you're going to go. Friendly person at this desk is going to greet you. Just manage those expectations so that first visit is less intimidating for them. Then, when you hit the lobby, this is where the real secret shopping happens. See what it looks like. And I'm going to give you guys a quick story. I will keep the stories to a minimum, but this one's really important. I was working with a massive family medicine practice in the DFW area, tons of clinics, lots of money, well-resourced, and they wanted to market. They wanted to grow. They had several new providers, needed to grow them. We did a bunch of strategies. They kept growing their new patient volume, but their total patient volume wasn't growing. So we took a step back, looked at what was going on. They had tons of attrition. So we did a quick secret shopping. A couple of their offices were beautiful, lobbies were great, all was good. Their flagship office, I walked in, and guys, I am not kidding, it looked like the DMV. There were flyers and brochures everywhere. There was a fluorescent light that was flickering. There was a sign that told me what was going to happen if I was late, what was happen if I didn't pay my copay, just all of this different stuff. And they're family medicine. We've got lots of choices in family medicine. That isn't an option. I grabbed one of their physician partners. We walked through their lobby, did not spend a penny, just tidied things up, worked on our signage, worked on our scripting of how those interactions happen, and it literally fixed the problem. They didn't need a consultant for that. You guys can walk in and do that in your own lobby. So see what that experience looks like. What does it look like? How does it smell? Does it smell like food? Did somebody, eat tuna fish for lunch? You want your office to smell like nothing, because remember, clean has no smell. What does it sound like? Is there a TV with something going on? Don't put a TV in your office. And if you do have a TV in your office, set it on mute. If you have any sound, make it like calm, like spa music. And I know I sound bougie, but patients in today's market expect more of a spa-like experience, and it's not that hard to differentiate and to do that. So see what your office looks like. And then the last step in the secret shopping, both for the hospitals and outpatient practices, is ask your patients. You know who the squeaky wheels are in your practice, and it is going to be painful. And if any of you are actual clinicians, by all means, delegate this to your administrator. This is what administration lives for. Have them ask those patients. And if you start with your squeaky wheels, dial it down to about listening to about 50% of what they say, because, everybody's got opinions about everything. But listen for themes. If they consistently say that Tom at the front desk is rude, or they consistently say that they, are 20 minutes late for their appointments, there is probably an operational issue that we want to hop in there and address. Maybe we need to move Tom back to the billing side. Maybe we need to put a little bit more cushion in time for those appointments. Just dig into those issues. And then also talk to your patients that are your really good patients, that are always on time, always on top of things, because they're going to have feedback as well. See what they say, and then take that feedback and do something with it. And then last thing, as we finish up feedback, but roll into what's even more important about it, is online reputation management. And I will be the first to admit that not all online reviews are true. They suck for healthcare providers because we can't defend ourselves and people can say anything they want. Own your listings. We can get more into that in the question answer if you want to. Look at the reviews, have somebody responding to those reviews, but most importantly, hear what they say. If there are trends, address those in your office. So now we've set the stage for getting ready to market. Now we've got a situation where we are ready. So 2 things to think about when it comes to marketing, and every practice, every hospital is unique. What do you have? Do you have time or do you have money? It's going to take one or the other. In a perfect world, we have a combination of both. If you've got time, that's actually my favorite. Very unsexy marketing strategies, but if you've got time, I love to take administrators and clinicians and have them get out in the community, start being involved with people, blog, make videos, do referrer outreach, do community outreach, do interviews. If you have money, hit things like search engine optimization, pay-per-click advertising, ads in actual magazines, advertorials, those articles that look like an article, but we all know that they're actually an ad, new mover programs. So figure out which one of those you have. And especially if you're a practice where you've got a new clinician where their schedule's not full, do a hybrid of that. Spend some money advertising them, but absolutely utilize that time that they'll never have in their practice again to get out and meet the community and meet referrers. So let's dive into those 2. We'll start with the general consumer. So most of the practices that I see represented here in the chat absolutely do have some direct-to-consumer advertising opportunity, certainly for the hospital. Patients often choose where they want to go. For sure, their physicians make referrals and that impacts them, but they absolutely in this day and age do their own homework. And same with practices. I get with a lot of those specialties, you end up needing a referral, but depending on what state you're in, maybe you can see them first. So let's talk about how to make you the go-to person for your community. And that is by becoming a trusted resource. How do you become a trusted resource? We want, when they think about healthcare, we want them to think about you. So especially for the folks on here that are more general, that are primary care, hospitals, anything that is early in that sort of referral pipeline, you want to be the first person they think of. And how do you do that? Showcase the personality of your hospital or your practice. Get your clinicians on there. Have them do videos. Have them talk about what they do, what they love treating, ways that they like to help patients. And your best content is the stuff that your patients ask every single day. They care about the lifestyle stuff, all of those things that you want to give education on, and maybe you have time, maybe you don't. Talk about all of that in those videos. And they don't have to be professional. They need to be believable and they need to be approachable. And people believe and approach folks on a simple iPhone video. Doesn't have to be anything fancy. Talk about any procedures that you offer, anything that's unique to your practice, anything engaging that people question about, and also give them a peek behind the veil. As humans, we are inherently nosy. We want to know who people are. So if your providers are comfortable, instead of, this is PT Jane who went to Harvard and did her DPT and has all these accolades, which we do want to talk about their accolades too, but talk about that she loves to spend her weekends hiking the Greenbelt and that, whatever is her favorite Austin-based restaurant, make it unique to your community, because then people start to go, oh, okay, I feel Jane is a normal person. Like I could actually see myself or my child being treated by her. So really, really use that as an opportunity to let people see behind the scenes into your practice. And then push that out through your website, through social, and then use it for community engagement. So especially since we have lots of PT, OT, speech therapy on here and the hospital, women control healthcare. They make the majority of the healthcare purchasing decisions. And then the subsect of women that are moms freaking own healthcare. Moms decide where they get healthcare, where their children get healthcare, and where their partner gets healthcare. And they all talk to each other. So especially in these specialties where you're treating pediatric patients, they talk good, bad, ugly, all of it. They are talking about you. So if you can get out, meet those people, get your practice, get your hospital in front of them, you are on a fast track to being sort of the preferred resource in the community. So how do you do that? Well, when it comes to moms in particular, there's all kinds of moms groups. There's early childhood PTA programs, moms of multiples, all kinds of things like that. hit Google, look in your community. If you have anybody in your practice that fits that demographic, have them personally engage, makes it way more authentic. And also, you can meet these people and meet your community, Chamber of Commerce, at schools. So if your kiddos are in school, get involved, start volunteering, make those organic relationships with sports teams, particularly if you happen to know somebody involved in it, volunteer. Do whatever feels natural as a natural extension of your life so that you can get to know people. And then the most important thing when you do all of this is you go do it, you go give to the community, give education, share information, volunteer your time, and don't sell your practice or your hospital. It will naturally come up in conversation. And if people know what you do, they're going to ask. Nobody wants to be sold to. It feels super gross and is off-putting. But if people find out that you are an avenue, a trusted resource, they will absolutely ask, and you won't ever have to sell them. Pivot over to the referrer side, and we can come back to direct consumer, and happy to answer like deeper questions on any of those. So, in my opinion, a referral from another clinician is like the creme de la creme of referrals because the patient likely very much needs your services. They have probably already been given some vote of confidence in you as a provider, and they've even potentially already had some workup and possibly, are further along in the process for you guys. So a couple of things that are really, really, really important in this. First, and it's again very unsexy, but you need to build a really, really good list of your potential referrers. Look at physicians, look at acupuncturists, chiropractors, therapists, social workers, school nurses. Anybody that touches a potential patient in their journey is a potential referral source for you. And we can get into later like who can write an order and who can't, but we can usually figure that out if we can actually get the patient to the practice. So come up with a really good list, do a little bit of homework on them, find out what they have, in their office. For instance, say you're a PT practice and you're going to call an orthopedic practice, yay, but they have PT in their office. You need to know that because when you show up, you need to make sure to tell them, we're not trying to take that from you. But if you have anybody that needs, maybe they don't have pelvic floor therapy, then you can be a referral source for that. And then you actually say to them out loud, we will never try to poach your patients. We'll always send them back to you. So do some homework ahead of time to be thoughtful about it. Once you get that list built, then you want a multi-pronged outreach approach. So the best is an in-person meeting. So call those offices, ask to visit. I try to start with the office manager if I can. Usually they understand a little bit more about what we do and how we could be of value, but I'll ask anybody. If I get a human on the phone, I will ask if we can come by. If you have a clinician on your team that is willing to go out, a clinician beats a salesperson 100 times out of 100 times. I can do a really, really smooth sales visit and I can answer any anticipated questions, but at the end of the day, I can't talk shop with patients, can't talk shop with clinicians. So if you've got a medical director or a nurse or a PT, anybody that you can take with you, you're going to have an easier time getting in the door and you're going to actually have a better visit. So set up those visits. If you can't get a meeting, show up. We can talk about that more in the Q&A, kind of how to do it and look smooth and not like you're sitting around with nothing to do, because we also don't want them to think that. And then secondly, figure out other ways to engage. You don't want to be a taker in the relationship. So if they've got social media, go engage with their social media, comment on it, like it. If they have an open house or doing an event, show up at it, send a plant, do anything. Every time you can get your name gently in front of a potential referral source, it just starts to solidify you as an option. It even starts to build a little social proof. So think about a multimodal way that you can keep those interactions happening, and then set up kind of what I call a nurturing schedule. Maybe it's once a month, maybe it's once a quarter. You are out nurturing that relationship in some way. Maybe a new procedure or a new treatment came out and you want to make sure that they know about it. Maybe a new law was passed that affects the way something happens. Anything you can do to educate them. And also, just like on the consumers, when you do actually have that face-to-face interaction, do not sell your practice. Remember, humans are inherently selfish. Most of them love to talk about themselves. So when you get in there, ask about them. Ask about their practice. Ask, hopefully you've already researched and you've done where they trained. Ask something about that program or share something you admire about it, or ask if they know somebody that you know from there. Healthcare is a super small world. Everybody knows each other. A good salesperson doesn't talk a lot. A good salesperson asks questions and listens. If you ask good questions and you listen, these potential referrers will tell you their pain points. They will tell you if it's hard to get patients in to see people at XYZ, if XYZ doesn't take certain insurance company, if, whatever it is, whatever their pain point is, then you flip that. And hopefully that is one of your strengths. If they have trouble getting people in, you let them know that you guys are going to do everything you can to see people right away. And also make them feel special, make them feel like you actually care. And at the end of your visit, give them your business card. Do not put your cell phone on your business card. Don't have it pre-printed on there. Handwrite your cell phone on your card. Make sure your cards aren't slicky. Handwrite your cell phone on your card. Give it to them. They're going to feel special that they got your cell phone number, and then tell them they can use it. Say, call me anytime. If you're having trouble getting a patient in, if you have a question, a lot of times I find with several specialties, the people that are referring, brilliant, but they may not know exactly what they need to put on the referral form, or especially when it comes to like imaging and things like that. Sometimes they're just not sure. If you can build that relationship where they actually feel comfortable calling or texting you and going, hey, I'm going to send you a patient. Here's what's going on. Not sure how we want to do this. If you can get that dialogue where they're comfortable actually asking, huge. You've got a new best friend. And then do it for them. I find almost never will they actually abuse calling your cell phone or texting you at a weird time. It's almost always useful. So be a really good partner. And then once you get those referrals, keep that relationship going. Probably not the clinician. Probably better to have somebody in the office that checks in with like their office staff. And remember, the clinician isn't your only potential referral source. You need to get to know the MAs, the nurses, the office managers. They're often the gatekeepers, and they are often the human that is actually making that referral. So maybe somebody in your office owns somebody in their office and once a quarter is checking in. I'll give you a super quick example on that. When I was with the hospital, one of the areas that I was really trying to grow was our outpatient imaging, and I watched that data like a hawk. And we had one of our really busy internists just drop off. Her referrals went down by like a third, and I couldn't figure out what happened. And so I'm very action oriented, walked over to her MOB, visited with her office manager, and she's like, yeah, I don't know, you're gonna have to talk to her. Waited around, talked to the doctor. And so I said to her, hey, Dr. G, I noticed that you haven't had very many patients coming in for imaging. So first, I just want to check on you, make sure you're okay. Hopefully you've been out on vacation or something. And second, if there's anything that we did, I would love to know about it so I can try to fix it. And she goes, you guys quit taking UHC. I said, we didn't. Tell me more about that. Help me understand. And she had a patient that had come to the hospital, had done some outpatient imaging, had seen one of our brand new baby radiologists. You guys already know the rest of the story. That particular radiologist wasn't in network yet. Somehow it got communicated back to her that the hospital and the radiology group had gone out of network with UHC. I was able to fix things for that one patient, assure her that we were all very much in network, and that if it ever happened again, just holler at me. We can fix that. And then we did on the administrative side. But such a simple moment, took very little effort, but saved tens of thousands of dollars worth of potential referrals there. So when you start to build those relationships, get comfortable asking, is there anything we can do to make it better? Is there anything we can do to make it smoother? Is there any feedback your patients are giving you that you think would be useful for me to know? People don't like to give us bad feedback, but if you ask for it, they usually will give it to you. So I know that's been a lot and it's been really fast. I'm going to stop there and let you guys unmute or drop in the chat and just let me know if there's an area that you want more depth in. Can do that. If you've got specific questions, would love to answer those, and I'll open it up.
Hey, Amanda. Thank you so much for all those insights. This is Jose Ferrua. I'm the president for NALHE. Thanks, everyone, for being here. Wow, what a lot of insights there. That was certainly some rapid fire and tons of great information. In your experience, if you have a practice that's struggling, I mean, you mentioned about the patient experience, putting yourself in their shoes, walking through the front door. What has been some of the biggest obstacles to maybe the system changing the way they do things consistently across, not just for that particular site you visited? Every system is different, they operate different, but sometimes it's kind of hard to move the needle. Any
Yeah.
thoughts, feedback on that?
Yeah, for sure, Jose. That's a great question. So, a couple of things. One, the more tangible the issue is, the easier it is to address. So, while you guys can and should do this on your own, we do it for practices sometimes. And when we do, a couple of things I do to set it up to be more successful is one, I record all the calls. Kind of sucks and feels weird and invasive, but it's really, really useful. Um, the other thing is really document super duper duper well as you go through the process, the things that are troublesome, who it was, what time of day it was, what else was going on. And then, my goal there is never to like punish anybody or throw anybody under the bus. It's to fix it. It's to figure out, was there a systemic issue that set this up to happen, or do we need to do some re-education? And so then I find it's really important to sit and do one-on-one training and let people hear themselves, especially on the phone calls. Jose, I can't tell you how many times I didn't actually have to do any training. We just sat through the phone call and they're like, oh my God, I'm so embarrassed. I must have been having a terrible day. Sometimes just doing that is super helpful for people. And occasionally we do find somebody's not in the right spot in the office and you can make that transition. But most people can be taught to change their verbiage and just little things like, if Jose, if you're the next person on the schedule and you're the only person in the office, if they open the window and go, Ferrua, versus, just pop open the door and go, hi, are you Jose? Little things like that cost no money, but completely change that dynamic are super useful. And then you mentioned across multiple sites. So once we kind of have a well-oiled machine, I'm a really big fan initially of using scripting. And it also kind of feels yucky when people are first given a script. They're like, what? You're going to tell me what to say when I do my job? And my thing is, I want them to start with a script and then take it and make it their own. But until you kind of learn that verbiage, and it's the little things. It's things like, instead of going date of birth, instead of saying what's the date of birth, saying, and what's your birthday? Little things like that really change the way that interaction feels. And so I think that can be huge. Consistent training, making sure everybody goes through the same training. And then last, like continual secret shopping. And I would even, like, if you're comfortable with it, I would even get people from different sites to do each other if they don't know it. That way they can walk in and see what's working, what's not working. And I've had some places where we even told them, we're going to be working on this for the next 6 months. We're going to be secret shopping. Sometimes telling them you're going to secret shop can help.
Very nice. Thank you.
Yeah.
Great insights, Amanda. Can you give us some examples of questioning? I know that's so important in the role.
Questing?
Questioning, listening and questioning how you can serve them. What are some good questions, go-to questions that you have?
Yeah, absolutely. So if it's a new relationship, sometimes you've got to give them a little something and then they'll start talking. So if it's a new relationship, I will always make sure they know that I'm not, trying to change anything that's going on. And, I'll just ask them, is there anything that you're looking for in a hospital partner or in a clinic partner? If they don't say anything, then I will go ahead and start preemptively saying, how are you doing with wait times? How are things with the referral process? Is it smooth? Are you having to, send in faxes multiple times? Are they forcing you to use a portal you don't want to use? Because a lot of people still like to use the fax. I'll just start preemptively asking questions. And if I know anything about the competitor, that helps. Once that relationship is established, then I'm pretty direct about, we love working with you. We are so honored to be able to care for your patients. What can we do better for your patients? Is there anything we can do to make referrals easier for your team? Are there any friction points your staff is running into? Are there any insurances or health plans that you accept that you're finding we don't, that we need to be exploring? Is there anything we can do to serve you easier? And I make sure I'm talking to the clinician, but I'm also talking to their staff there too, because a lot of times the doctor may not know, but by God, their staff knows what we do to make their life hard. And so asking the staff is huge. Yeah.
Great, thank you.
Yeah. And if you don't mind me throwing it back to you, do you have any? He's a physician liaison, so he literally does this for a living.
Yeah, I mean, you mentioned it before, but it's in the rule. It's key to be curious, and then like Amanda's saying, not sell. I mean, to listen to them, and ask them about the details, depending on the rule. Like she said, often I'll position myself as being an advocate for them into our system, and then as she said, Amanda mentioned, how can we better serve you? And if there's a delay, it might not be in the top of their head. Maybe they don't really know me. Then share this other practice said blah 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 blah, and use that to breach it. But it's always good to have a dialogue with them rather than sell, like Amanda was saying. Yeah.
Yeah, I agree. And I actually do script out questions before I go the first couple of times, especially if it's a new specialty. Any other questions?
I have a question regarding front office employees.
Yeah.
Being that they're like the first impression of the company. Well, I mean, we talked about the look and feel and all that, but do you recommend or can you recommend any formalized training for them that would, I mean, because if there's a position that opens up, you just find somebody to fill the position, and
Yeah.
they come into your team without necessarily knowing what to expect and how to, you don't never really know how they're going to treat your patients and that kind of stuff. So can you recommend anything like that?
Yeah. So it's huge, huge, huge. And it's ironic. We take our lowest compensated people that are often overworked, and they are literally the front door to our practice. So hiring for fit is really important. You can train them to do anything. You cannot train somebody to smile that is not a smiley person. So starting with that personality. When it comes to training programs, a couple of the ones that I've seen that are really good, they are not healthcare specific, is the Disney Institute and then the Ritz-Carlton Institute, both very hospitality focused. And I would not recommend sending every person because it's expensive, but maybe you take one of your leads, send them, and then they come back and they kind of become the trainer and train the rest of the team. Studer Institute has some stuff too, but it's a little bit more high level. And I do think you can do it internally. It's so important, and it's little stuff. Like when you open that door, one, if there is glass, I'd love to get rid of it, but if we have to keep it, fine. But teaching people that when somebody hits that door, look up, smile, make eye contact. And if you're talking to somebody, absolutely fine. Acknowledge that person, be right with you. Just that little people skills is huge. And yeah, so somebody dropped in the chat, PAHCOM is an organization for front staff too.
Yeah,
Awesome.
it's an admin staff. Early on, you mentioned it kind of indirectly before, when you're thinking of building relationships and selling, sometimes you think of the beyond the current person, the doctor or stuff, how to help them.
Yeah.
Front staff, this is an organization that focuses on office admin. So knowing how to interact with them, but they probably have training
Amazing.
programs for them.
Yeah, definitely. And one other thing, in addition to making your patients happy, when that patient gets back to see your nurse practitioner, PA, PT, whoever, you want them to be happy. You don't want them to come in hot because they've already had a bad interaction up front. So it also helps set your clinicians up for success. I have a ton of blogs on it too. If you want the kind of cheap and free homegrown way, if you just go to brummettgroup.com, there's probably 10 blogs just on front office staff that you could totally steal and use.
Yeah, excellent. And it's very curious that the I guess the focus is on the hospitality and not on, how to operate in a medical office.
Yeah, I mean, I think the thought being we can teach you how to work referrals, we can teach you how to answer the phone, but man, that friendliness is huge.
Very good. Thank you so much.
Yeah.